So it's obviously a fantastic opportunity to have been designated as a global digital exemplar, and we're really excited to be working with our partners System C. Over the next 2 to 3 years, we'll develop and implement a suite of tools which will really make a difference for the clinicians working in our hospitals and also for the patients visiting them. Although our overall digital strategy is unchanged, the Exemplar programme really gives us an impetus to crack on at pace and deliver tangible benefits. We hope to demonstrate what can be achieved when world-class clinically orientated software is deployed in a large UK hospital. When I'm called from the intensive care unit to review a deteriorating patient on the ward, I need access to lots of information about them, both from our hospital systems and from the community, to make decisions quickly and appropriately. Current medical problems, past medical history, drug history, allergies, observations, x-rays and scans, infection status, falls risk, blood results, and on and on and on. One of the most common complaints that we receive as Chief Clinical Information Officers is that staff have to access multiple different systems using multiple different logons and many different passwords in order to access the information they need to do their jobs. Patients coming to our hospital have contact with many different health professionals at multiple time points in their stay. And these clinicians often work in teams, they're not confined to one particular location. The deployment of the System C clinical suite CareFlow aims to tackle these problems by providing teams with access to vital clinical information via handheld, tablets or desktop devices. Teams can collaborate securely in patient or team context to plan and communicate, delivering the care that the patients need. This has got a number of components and we'll be implementing them progressively to reach the final integrated workspace. One of the first products we'll deliver to the wards as part of the CareFlow clinical suite is the electronic observations package. This allows staff to capture nursing observations and assessments digitally, providing decision support at the point of care and automatically calculating national early warning scores and fluid balance. As new scores are generated, they form part of an escalation path that advises those taking the observations of the next actions, including notifying clinical teams of a deteriorating patient. We see the use of CareFlow for handover as a great opportunity to improve both the quality and functionality of the handover process.
Well, using CareFlow in a clinical acute setting is truly transformational. But what I'm really excited about is actually giving that technology to care professionals in the wider community, social workers, mental health professionals, because as we know, patients' care is not within the boundaries of an acute organisation. It goes much, much wider.
As we deploy these tools, we expect to find teams developing new ways of working by using information collaboratively in real time and independent of physical location to drive clinical decision making, reduce delays and reduce unwarranted variations in care. When we get to this point, we will have truly realised the benefits of digitisation, and we will enable other organisations to learn from our experience. This is our real challenge and we can't wait to get there.
As the Chief Operating Officer of the System C and GraphNet Care Alliance, I'm really pleased to be working in partnership with Bristol on the GDE programme. What the GDE programme does is allow the NHS and us as a software supplier to move faster to achieve digital maturity across the Bristol community, which, once we've done it, will transform the use of technology for our clinicians here in Bristol and act as a precursor to the strategy for population health.